Go ahead and give us your name.
My name is Jan Price Hells. I practice at Stone Creek Dental Care in Arizona, Chandler, Arizona.
Why do you think the oral to IV device is so important to you?
It is very important specifically because it saves lives when we can detect oral cancer early.
And then giving feedback from your patients.
Sometimes I'll have patients ask me, have you ever found oral cancer? I mean, and I just have to look at them and say, yes. My husband, when he was 29 years old, was diagnosed with oral cancer on his tongue. Squamous cell carcinoma was the diagnosis. At the time, we had three small children, a 6-year-old boy, a 3-year-old boy, and a 6-week-old baby girl. And I'll never forget the day we got the call. My husband had tried a couple different routes, eventually went in to an ENT, and they took a biopsy. And the next day, we had to go up to the cancer center in our state. And it was really discouraging. After we met with the doctor, we left, and they didn't know how deep it went. They didn't know if he would have radiation. They didn't know if he would need chemo. They told us they didn't know if they were going to have to remove part of his mandible to get to the cancer. So there were a lot of unknowns. It was a really scary time. Having a new baby and small kids. At the time, I wasn't a hygienist. I had done assisting, and just the thought of losing my husband when he was 29 was overwhelming. He went into the surgery, and they removed 25% of his tongue. After the surgery, he could not eat for 6 weeks. He just had to have broth. And then he had a long road ahead of him. It just doesn't stop there. He had to relearn to speak. He had to learn how to eat. In fact, he would spend nights, late into the nights, watching different videos trying to perfect his speech. So you can't tell. This month, actually, it marks the 23rd anniversary. And with the type of cancer he had, if you take 100 people that were diagnosed at the 7-year mark, there's only 4 that are still living. So this is something I feel very passionate about. And when I tell a patient his story, how can you say no to having that? And I don't want anyone to go through what my husband has gone through. I want to catch it early. I'll talk to a lot of patients and tell them this story if they're smokers or if they're chewing, because if I can save just one person from going through what we went through, it's completely worth it.